Okay, so you are considering this bottle as the 160 ml of bottle, which is having 120 ml of medicinal solution of Aralia resinosa 0/1, which was prepared from only one globule of poppy seed size, which was already medicated by the pharmacy. One query was there in group about first session. Okay, so what you need, whether you give in acutes or you give in chronics or in any cases, every time you need to give 10 downward strokes. Ask your patient not just to stroke like this, but let them tell 2 or 3 times and have a experiment or practical in front of your eyes. Okay. Then after giving 10 downward strokes, when you are using very first time the first remedy to your patient, if you are unsure about that the whether patient is sensitive or weak or not, then you must take precaution that homeopathic aggravations with LM in hypersensitive or sensitive or weak patients can be there with LM potency with first dose. So to avoid this thing, what Dr. Hanneman advises or guides us that you need to put the required quantity of medicine in first cup of water, stir it well, then take out 2 teaspoons of that solution from that cup. Then you will put it in another cup which is filled with water. You will stir it well. Then you will take 2 teaspoonful of solution from that, and you will put that in third cup of water. And patient will take 2 teaspoonful of medicine from that third cup of water. Rest of the solution or medicine which was there in all the 3 cups, you need to discard it. This is applicable for first dose. If your patient is tolerating very well the first dose, at the third cup, in second dose, you can cut out that third cup and you can give second dose in from second cup of water. If he is tolerated very well, that second dose, he is not having any aggravation and his symptoms are started improving, then you can ask him to directly take 2 cup of medicine from that 2 teaspoons of that solution from first cup only. This is the guideline given by Dr. Hannibal. So I think I am clear in English also how to give this medicine to the patient. Now I will come to the queries first, which were asked in group. सो द लास्ट क्वेरी सर एक बार रिपीटेड करो कि सेंसिटिव है तो किस कैसे एलएम पोटेंसी प्रिस्क्राइब कर कर रहे हैं। मशीरा मैम आप क्वेश्चन मुझे इस पे पूछ लेना। सीएम पोटेंसी देने के बाद अगर पेशेंट को एग्रेवेशन होता है तो क्या करना है। तो सीएम पोटेंसी के बाद में अगर एग्रेवेशन होता है तो यू नीड टू एंटीडोट योर केस विद द प्रॉपर एंटीडोटल मेडिसिन। But what I have learned in my practice from some of the seniors and what I am following in my practice that I will give the medicine means if I have given the patient sulfur in CM scale and patient has homeopathic aggravation, then I will give the sulfur in 60 TDS for 2 to 3 days. Now, the major difference of homeopathic aggravation between CM and LM, what happens in both of them that in LM scale, the aggravation will last only for 2 to 5 days. But in centesimal scale, this long for the longer period of time, say in days or in weeks or in months. So I think I have answered the query by Dr. Poonam Dhut. Then, sir, please tell us in what type of patient we can use decimal CM and LM potency. So LM potency is indicated in all types of chronic and acute cases. What as per Dr. Hanneman, I am using in very acute, in emergencies also. I am using it in chronics also. I am using it in acute also. So there is no question from my side. But there is one contraindication Dr. Hanneman says where not to use these LM potencies. So that contraindication is when the patient is having the symptoms on the skin which are indicative of the miasm. So agar if patient is having figward or growth and you are on the skin, or patient is having the itch on the skin, or the patient is having the chancre or ulcer on the skin or oral mucosa, then the LM scale is contraindicated as per Dr. Hahnemann. But before knowing this thing, I have used in these cases also, but to my luck, there was no aggravation. So a query I think Dr. Poonam Dutkaita, so I have solved that one also. Then, sir, also you mentioned that only 12-15 doses can be prepared at once. What if patient is doing well on the prepared potency and need more than 15 doses? So, if 15 doses are here, I think Dr. Iram Sadiq Khan is asking, sir, also you mentioned that only 12-15 can be prepared. Huh. I'm not saying that I'm not saying that only that much doses are prepared, but Dr. Hahnemann has advised to prepare 18 doses from one bottle maximum. That is what Dr. Hahnemann writes. I will let you know what I do and how I repeat. So maybe answer ही कर देता हूँ. इसके बाद में सर डॉक्टर निसरीन सर यू यूज वन ग्लोबुल ऑफ 10 size which is medicated. Yes ma'am, I have already shown the bottle of Aurelia resinosa. Sir, please explain the dose that mark how much ml given to the patient in acute and chronic diseases. That totally depends on your decision how many doses you want to divide this medication solution in how many doses. मान लो कि if you have given 3 doses in acute to your patient and patient gets cured or he is almost all right near to cure, then you need to stop this medication. Then Dr. Rohit Kumar is asking chronic case में LM को कितने बार देना है? Sir, I have already told. Dr. Hahnemann advice is once in a day, twice in a day, or alternate day, or once in a week, or once in a 15 days. So this is what Dr. Hahnemann said. I will cover my what type I am giving. I will request Dr. Rupal Shah. Okay, ma'am, I will share that in YouTube also. Both the sir, Dr. Rashmi Bayani, sir, you took 120 ml of water in. Yes, I have. This is 100 ml bottle actually, but I have told you to consider it as a 160 ml of bottle, and it is filled with 120 ml of water. Sir, can you please clarify? We don't have to give stroke if we are giving first dose, but strokes are needed thereafter, like for second dose onwards. Yes, ma'am. According to philosophy, what I have read, I don't found that thing in organon when I was preparing for this session. That first dose does not need to get succussed. But what happens in our clinical setting, no? When you are telling the patient to give 10 downward strokes, already I have given 2 or 3 strokes in front of him, and I have asked him to give 2 strokes in front of me to see whether he is giving the succussions right or wrong. So this is the practical aspect. Dr. Monica Singh is asking, sir, which water did you use, distilled or RO? So very good question, ma'am. Dr. Hahnemann advises us as like he has advised to use rectified spirit, but I am using Saclac for the reason I already discussed. But you should use, Dr. Hahnemann advises to use distilled water to prepare this solution. But our distilled water in India, we usually get that water in plastic containers. So plastic container is having its own chemical properties. So the mixture of that chemical properties within that water cannot be ruled out. So I am not, and that is also not feasible to order that much, and no company is giving that in what we can say in glass bottles. If you get in glass bottle, you can use distilled water for sure. Then among RO and UV, so again, UV water is treated with the rays of ultraviolet. So our some medicines are prepared from such a rays also. Like X-rays, we have the well-known medicine. So the chemical properties or radiological properties of that ultraviolet rays can be there in that water. So I strictly avoid using UV water to dilute. I have one water filter placed in my clinic, which is without UV, but it is a water filter. I'm using that tap water for dilution. Then next question is, please explain chronic again. I have already explained. Okay. Are you clear up to this? अभी मैं यहाँ के चैट बॉक्स में क्वेश्चन लेता हूँ। कृष्ण मुरारी सर, मेडिसिन बनाने के बाद में पर डे भी स्ट्रोक करना है? सर एवरी टाइम यू नीड टू गिव स्ट्रोक। जब भी आपको मेडिसिन देना है यू नीड टू गिव स्ट्रोक। खाली स्ट्रोक में आपने ध्यान रखना है कि आपने जितना पेशेंट को बोला है हर बार उतना ही स्ट्रोक देना है। यू डोंट नीड टू इंक्रीज दोज स्ट्रोक्स। देन नेक्स्ट इज, चलो कोई क्वेश्चन नहीं अभी किसी का होगा। मैडम आपका वो क्वेश्चन मुझे समझ नहीं आया था। मसीरा मंसूरी मैम आप पूछ लीजिए, फिर मैं आगे बाकी लोगों को।
Sir, can I talk
यस सर प्लीज।
in Marathi?
यस बोला बोला।
सर जी बॉटल आपण बनवून दिली ती जर पेशंटला रिलीफ आहे आणि तो रोज एक डोस घेतोय, ती संपली, नेक्स्ट टाइम आपण परत ग्लोबिल बनवून तेच 0/1 द्यायची का 0/2 द्यायची?
गुड क्वेश्चन सर, दिस इज रिगार्डिंग फॉलो म्हणजे so sir's question is that if patient has improved after few doses and some medicine is remaining in that bottle, so the patient needs to take that medicine or not, and the patient is absolutely all right and he visits the clinic, so does we need to go for 0/1 or 0/2? This is the question by sir asked in Marathi. So
Yes,
the
yes,
answer,
sir.
so the simple answer to this is, when you are what Dr. Hahnemann says, when the patient is near to normal or he is cured, then this is the time to stop the medicine. If you won't stop the medicine at that time, the patient will get change symptoms. So there are some students from college have joined over here. I will like if someone answers what are change symptoms in chat box. I will really like if someone types the meaning of change symptoms in chat box. I will talk about that change symptoms later. So the answer to sir's question is that what I do in my practice, I will, when I am giving this bottle to patient, I always advise to the patient, whenever he is better up to 80 to 90%, he will call me and just stop the medicine. I will tell him what to do with the medicine. So what happens in clinical setup, if this bottle is full and patient has just consumed only 3 doses and the medicine is remaining, so patient has his own psychology that if doctor asks to throw away this medicine, he has that psychology that he has paid fees for this medicine, so he will take and he will have same symptoms. Okay, so this is the difficult practical difficulty. So what I do, I will ask the patient to visit clinic or send this bottle with someone to the clinic. I will just discard this medicine in my clinic. I will put the fresh water in that bottle. I don't put any medicine of 0/1 or 0/2. Next potency if he is 80 to 90% better or 100% better. And I will put just the 5 to 10 drops of Saclac in this bottle so that he can have the satisfaction that he is on the medicines. So I think, sir, I have answered your query.
Sir,
क्रॉनिक केसेस में एलएम पोटेंसी मतलब पावर क्या यूज करना होगा?
Sir,
या
in each
0/1?
and every case, I will advise to start your cases with 0/1. If you don't have 0/1, you have 0/2, you can start with 0/2. This is what now these potencies are not easily available. I have in my last session, I had told that I was needing Magmore in LM potency to one of my case, and nearby pharmacy, only one pharmacy in Nasik was having Magmore in 0/22. So that was the case that actually taught me my clinical experience that 0/2. I have started that case with Magmore 0/22, and that case was solved only on that 0/1 only. So there is this is regarding availability, but to start with, you must have to start your case with 0/1. अभी जैसे मैंने as like I have told you that 1 or 2 poppy seed size use कर, we have to put to prepare that single dose solution. Some doctors in what I know, few of the doctors, some are using, some are skipping 0/1, 2, 3. They are starting their cases by 0/4. This is the group of some doctors. Some doctors are skipping 0/1. They will start their cases by 0/2 for no reason. There is no reason written in any literature, whatever I have read in this last 4 5 years. Some are using alternate potency. They will start their case with 0/1, go to 0/3, go to 0/5 like that. Or they will start with 0/2, they will go to 0/4, they will go to 0/6. So this is not having any base in philosophy, organon of medicine, 6th edition. Some are doing jumping potency using jumping scale. So they will start their case with 0/1, then they will give next follow-up, they may give 0/5, in next they may give 0/10. Some are following the pattern of what we can say, they will start their case with 0/3, then they will go to 0/6, means in multiples, then they will prescribe 0/9. Few of the practitioners I have read, they are using directly 0/30 in their cases. So this has no base. This has own their experience. I don't criticize anyone, but this has no base in context to 6th edition of organ. So is
Sir,
it clear, sir?
सर
if
माझी शंका
children
अशी आहे.
having fever,
हाँ बोलिए
Hello.
प्लीज वो नंबर हाँ
if
Sir,
children having fever as up to the 102 or 103 degree, then also we have to use LM potencies as 0/1 and 0/2.
Yes, so what Dr. Hahnemann writes about in cases of fever, na, Dr. Hahnemann writes to give administer medicine when the fever is declining or the patient is in a febrile phase. So in acutes, you usually can see especially in fever cases, what I have experienced, you usually can see aggravations with LM 0/1 also. To avoid that aggravation, I will request you to give LM 0/1 in 5 cup, as like I told you, 3 cups, up to 3 cups I have told you. Same you will prepare it up to 5 cups because patient is in your clinic at that time, most of the time. And you give that 0/1 cup, 5 cup, so you will give 1 or 2 teaspoon to that patient, but not in the acute fever. If the fever is rising and you are giving medicine, then there are 100% chances that the symptoms of disease and symptoms of medicine both will collide with each other and they will raise the fever more in such a cases. सर मराठीत कोण बोलत होतं ते बोला आता.
सर मागाशी मी जे विचारलं ना, माझी एक
हा,
शंका अशी आहे,
बोला.
समजा आपण ते सोल्युशन पेशंटला बनवून दिलंय,
हम्म.
हा ते संपलं आणि आपण सांगितलं तुला बरं वाटतंय तर तू बंद करून टाक, आणि तो परत 4 दिवसांनी आला की सर मला आता हे बंद केल्यानंतर मला त्रास होतोय, तर मग त्याला 0/2 द्यायचं का 0/1च परत कंटिन्यू करून द्यायचं?
Actually, it is not term as cure, sir. If such a cases comes to you, you need to take fresh totality. Then if the same medicine is coming up and the patient is having the solution with him, then you can continue with that solution. If patient is not having that solution, you need to start that case from next potency 0/2.
Okay, sir. Thank you.
Dr. Bagal,
Yes, sir.
I need to a question regarding this 50 ml. There was a cat 1 week ago was hit by a car very badly.
Okay.
And the owner brought this to hospital, and L4 and L5 was hit very well, and she was about to be paralyzed, the backside extremities for that back section. And then I asked him to give Hypericum 3X.
Okay.
For 5 days they gave it, but still I want this improvement. Thinking about this, I will give LM or I will go directly to 10M to improve this situation of it's hurted very badly, this cat, and it's improved. Now she's taking herself, even the legs are not working, but she having a better energy to move, go behind the owner. So LM or 10,000.
Okay, I will advise you to go with 200 in this case, sir. If the patient is improved in such an acute emergency with 60, that means your remedy was very correct. That's why it has worked. But directly going to 1,000, I don't advise you to go in your case, especially. You try to give 200. If patient improved and improvement is stopped, then you can think of 1,000. Dr. Masira is asking how to prescribe for welcome, sir. How to prescribe for non-sensitive patients for LM potency. So you does not need to dilute the solution in cup. So simple answer. Dr. Aparna Deshmukh, medicine symptoms after giving LM potency repeatedly. Okay. So I think no one has written here about change symptoms. I will talk about change
Yes.
symptoms. Okay.
Yeah, those are the same symptoms.
Okay. So these are the change symptoms. Uh, Means you have prescribed arsenic to your patient. Patient was improving. He has improved a lot, around 90%, 100%. You have given him LM 0/1. Then he visited second. Then you given him 0/2. And after finishing 0/2, he was all right. And you filled up 0/3, and you have asked him to take 0/3. Then he will have those symptoms of the disease again with him. So this, if you know when to stop LM, then you can avoid this aggravation. So I am coming again to the topic. Dr. Kent's observation of homeopathic aggravation says us to that the aggravation, homeopathic aggravation after giving the remedy will come first, followed by declinement of the symptoms. So what happens in LM scale? You will get symptoms of the disease or homeopathic aggravation at the end of the treatment when the patient is near to cure. So what you need to do that at time, you just need to stop the medicine. This is one way Dr. Henneman advises us. Second, if your patient is 90% better and he started to show same symptoms, same symptoms of the disease for what he has visited you. So at that time, you need to give the medicine after a long gap. I think Dr. Hanneman writes a gap of about 14 days or 28 days. This is second option, but prefer to stop the medicines and just wait and watch. You don't need to antidote as we need to antidote in centesimal scale. Dr. Imran Khan is asking, and also how do we go from 0/1 to 0/2 if we have to prepare it by ourselves? Sir, I need to take session for
Uh,
this.
uh, yeah, sir. Actually, I wanted to ask, like you mentioned, that there is unavailability of some 0/1 or 0/12 potencies. So in
Hmm.
that case, actually, I'm recently facing a problem. I have prescribed Pandurando 0/12, but I am not getting 0/13. So in such cases where I'm not getting 0/13, so what should I do?
Madam, I have already advised, I have already discussed my experience about Magmur case. I was not getting Magmur below 0/22. I waited for 1.5 months, but my case was heading in LM only. It was a case of thyroid. So I got 0/22 and I have started with that only. What you need to do now, 0/1 to 0/3 are what I can say. These are safe potencies. So you can play like that. See what happens now in your clinics, you always try to play with the potencies. I am using centesimal scale also. I am using mother tinctures also. I am using biochemic and LM also. If you are confident enough about to, when I was given one of my case, it was a case of psoriasis. The patient was through and through on mental and physical levels. Totally, the case was of sulfur, and the disease was long-standing since 13 years. I have prescribed him sulfur CM. I have not slept for 2 nights. I was waiting for his call, and I was waiting that he must have got homeopathic aggravation. But I was in my mind that the chronic deep-seated pathology cases will usually respond to higher potencies. Before that, I was starting my skin cases with 30, then I need to wait for 1 month or 1.5 months, then I will go to 200. So that was the scenario at that time. But I countered that case. I have given the CM, and you don't believe, I did not repeated that CM again, and that case was solved only on single dose at that time. So you need to play with your potencies in your clinical practice. What my clinical practice told me about LM 0/1 to 0/3 are safe potencies. Means you can repeat those potencies in BD or TDS in chronic cases also. That is my experience. That is not Dr. Hanneman doesn't advise TDS dose, but I have given. If you go to 0/4 to 0/9 or 10, तो 0/4 to 0/10 तक आपको देना है OD और अल्टरनेट डे. If you are starting your patient, or if you follow, you are giving more than 0/10, from 0/11 you are going, then you need to have a gap of 2 days or 3 days, twice in a week or once in a week, to avoid homeopathic aggression. This is my personal experience. This doesn't have any base with any literature.
Okay. Thank you.
Okay. Dr. Yashasvi is asking how willingly patient accept this method of taking medicine, especially in acute cases in hypersensitive patient. That's up to you, ma'am. Now, when patient is pure medicine still continued, upper Adesh, no, ma'am, no. We need to stop. Is it compulsory to give rectified spirit or SLU? Sir, I already answered that I am using Saclac liquid only because rectified spirit, to keep rectified spirit in your clinic, you need a license from government and they वो झमेला होता है मेडिसिन सिम्टम्स अब तक ये तो आंसर हो गया है if anyone have any question please ask or otherwise I will move to next topic
I have another question, Doctor.
Okay.
The patient of 65 years old, the diagnosed was bipolar, but anyway, very aggressive when the hysteric, attacks are there. At the time of these situations, that there should be repetition of, I'm thinking about LM. La cases
Sir,
was
LM,
given.
LM is indicated in each and every case. There are just only 3 exceptions, what I already told, and fourth, what we can say exceptions in acutes regarding fever. You can add
Yeah.
that only. Remaining of the cases, in each and every case, you can use LM potency. So the problem what madam was asking me to, she was not getting that Kundurango in 0/12. So there is one homeo pharmacy in Pune known as Jeevan Homeo Pharmacy. I will put their card in our group, and also I am in talk with them to get discount, maximum discount, applying coupon code who are attending this session or seeing this video on YouTube. So they are having a wide range. They are having the what we can say St. George's. If someone was asking me which company's medicines are better, so the pioneer of LM scale in India was the what I have said, that company in Kolkata. I will just let you know.
HAPCO?
Yes, HAPCO. HAPCO is the pioneer in India. That too, they are having a lot of experience to manufacture, and that is the only company which is actually using poppy seed size globule to manufacture. But what problems remains with that? I am practicing in Marshi, near to Marshi place. The 4 months of rainy season is you get humidity of around more than 90% all the time. So I don't use the globule of 30 size to dispense 30C potency, which is advised by centesimal scale, but I am using the bigger size, because if I put the medicine drop over there and give that file to the patient, so due to moisture, they get dissolved. So I have stopped using 30 size number of globules for centesimal, and I am preferring LM scale of other companies over HAPCO. So HAPCO is the pioneer. If you ask me which is the better company, I don't go in that war of those companies, but that is the pioneer company. This Pune's Jeevan Homeo Pharmacy is delivering medicines of St. George's. Then you can get medicines of Schwabe. Schwabe is using more larger size. SBL using size of what we can say SBLs, and St. George's size of globules is same. Then if you need means that the Jeevan Homeo Pharmacy who is delivering that St. George's medicine, he is having 640 remedies from 0/1 to 30, and plus 80 remedies which are they are manufacturing of 0/2 to 0/30. Then the remedies like carcinosin, brain, heroin, streptococcus, and staphylococcus in LM, they are also available with Jeevan Homeo Pharmacy. So I will talk with them and let you know what discount, maximum discount they can give to our subscribers or participants of today.
Okay, sir.
Okay, so I will move to next topic, how I am giving, because we are lack of time, we are just remaining 8 minutes. So up to here, I have talked about Dr. Hahnemann, what Dr. Hahnemann sir advised us to give, लेकिन हमारे clinic में हमारे अलग problem होते हैं. Okay, is it right?
Yes, sir.
पेशेंट का जब आप बोलोगे ना, when you say to the patient that remaining medicine from this cup you need to throw, he will he will see your face like this, that I am paying you for this medicine and you are just asking me to take 2 teaspoons full and asking me to throw 98% of the quantity of medicine. So patient won't get agree so easily to that thing. Then the glass bottle is I was practicing with amber color glass bottle also. Then I shifted to amber colored plastic bottles. Then it was again having some issues with that amber color plastic bottle. The quality, the plastic, you can smell that plastic. So medicines quality, we cannot assure about that thing, that whether it is going to work or not. So दिस इज अभी अभी मैं मेरे बारे में बोलूंगा, मैं यूज कैसे करता हूँ. मुझे पेशेंट को अगर कम दिन देना है तो 25 ml का बॉटल है. थोड़ा ज्यादा दिन तक देना है तो ये 50 ml का बॉटल है, प्लास्टिक बॉटल है. दोनों को कैप लगी हुई है, दोनों को यहाँ पे ड्रॉपर है. राइट. सो सेम कि मैंने एक ग्लोबुल डाल दिया, नेक तक मैंने पानी भर दिया, पेशेंट को बोल दिया कि 10 स्ट्रोक देना है. यहाँ तक सेम है. आप बड़ी बॉटल लो, छोटी लो, कोई भी ले लो. राइट. So up to this, it is same. Now I will tell the patient, if I am giving this 25 ml bottle, this you need to pick up like this. Ask the patient to hold between these two fingers and ask him to stop like this. 10 stops. यहाँ तक पूरा सेम. अभी आगे क्या करना है? Now I will ask the patient to put 5 drops, 7 drops, or 10 drops of this in a cup of water, and I will ask him to consume the whole quantity. ओके. कम दिन तक अगर देना है आप इसको, अगर इफ यू आर गिविंग 10 ड्रॉप्स 2 times in a day, this 25 ml goes daily 2 times in a day, goes up to 1 month आराम से. अगर मुझे पेशेंट ऐसा लगा कि जिसको दवा ज्यादा लेने में भरोसा है, या फिर वो इज नॉट गिविंग फॉलो अप विद इन 1 month and I need to continue the same medicine for 2 months, then I will use 50 ml bottle. सेम I will tell him, ये करना, 10 बूंद डालना, वो पानी को स्टर करना, पूरा पानी पीना. दिस इज द प्रैक्टिकल वे आई एम डूइंग इन माय क्लिनिक since last 3 years and I am getting results. Next question. In follow up, if I need to give the patient 0/2, then I will discard this bottle. I will take new bottle. I will prepare the new solution and I will give him to the give to the patient. I will not use same bottle at any cost. Third scenario, if my patient is arsenic and if he is needing some intercurrent some remedy, symptom totality has been changed and he is now needing lycopodium. Okay. So I will stop that arsenic. I will prepare lyco in lyco 0/1 in this bottle and will ask him to take medicine from this bottle. This is the way what I practice LM scale in my clinic. अभी इसमें मैं करता क्या हूँ, I have bigger size of label which are covering almost 3/4 of the bottle. So the question of using amber colored bottle or the opaque bottle. So this is opaque one. What I shown you, this is transparent. I am not using this bottle to dispense LM. I have already told you that consider this as a amber colored bottle. But I am using this is opaque, so direct sunlight or sun rays cannot enter this bottle very easily. Plus I am using the sticker over here which will again prevent, so the purpose of amber color gets satisfied in this scenario also. Then some patients are there ki the liquid prepared in LM looks like water, so you need to add more drops of sacchalant so that it can smell like medicine. So that is practical experience you need to have. Then if so there is one problem with that Pioneer company which is preparing LM, that their medicines usually come in transparent glass bottles. So Dr. Hahnemann hasn't advised to store medicines in transparent bottles. So you need to keep that medicines in a closed container which cannot be exposed to that thing you must have with your. जैसे भी सेंट जॉर्जेस का बॉटल है तो दिस इज अम्बर कडल ग्लास बॉटल. देन ये जो भी मैंने बोला था कप मेथड का आप यू ऑलवेज यूज, जो मैं मेरी इसमें मतलब ये भी दे दिया मैंने, तो ये मैं कप मेथड पहले डोज के लिए यूजुअली क्रॉनिक हो या एक्यूट हो या फिर सोरिक केस हो तो उसमें आई विल यूज कप मेथड अप टू थर्ड कप फॉर फर्स्ट डोज ऑलवेज, सेकेंड डोज सेकेंड कप, थर्ड डोज 1 कप, एंड देन आई विल कंटिन्यू विद द विदाउट कप. ये 10 ड्रॉप वो डालेगा और पूरा का पूरा कर ले. देन कहाँ पे हमने एलएम पोटेंसी को यूज नहीं करना है. एक्चुअली दिस इंडिकेशन इज नॉट रिटन एनीवेयर द बुक्स, but if you are having scarcity of the symptoms and the case according to you is incomplete and you are thinking that the remedy you are prescribing is doubtful, you are doubtful about the constitution, then please don't go for LM scale. Sometimes I use 2 globules because what is ना, जैसे पेशेंट का साइकोलॉजी होता है वैसे अपना भी होता है. जब मैंने पहली बार यूज करा था तो मुझे तो खुद को नहीं लग रहा था. अभी कुछ लोगों को तो मैं देखता हुई मतलब why these companies are selling this bottles like 30 grams. So there is no necessity. This 30 grams it may मतलब ये चलेगा हमारे 3 जनरेशन तक. लगेगा एक ही ग्लोबुल ना एक पेशेंट को, ज्यादा से ज्यादा 2. तो इसमें इतने लाखों ग्लोबुल है तो अगर ये आरएलए रेजिमोजा हमने खत्म करना है तो मेरी शायद से 5 जनरेशन खत्म हो जाएगी तब ये बॉटल खत्म होगी. तो कंपनियां इसको इसलिए मैन्युफैक्चर करने लगी क्योंकि कुछ हमारे जो प्रैक्टिशनर्स है वो हाफ ड्राम भर के देते हैं और कुछ लोग पाउडर में डाल के देते हैं, बहुत सारी गोलियां सैक्लेप पाउडर में वैसे बना के देते हैं. आई हैव नेवर यूज दैट लाइक दैट, 1 or 2 maximum 1 or 2 and they are giving fantastic results. Then the next question may come to your mind that if your patient is on centesimal scale and if you want to shift that patient to LM, then what to do? आ सकता है ना. इक्वेशन आ सकता है ना. हेलो.
येस सर.
Yes, sir.
मुझे लगा सो गए क्या.
नाही सर.
सेशन बोर चल रहा है क्या.
Absolutely
No,
not.
sir. मजा आ रहा है.
इंटरेस्टिंग सर.
ओके नहीं तो खाली मैं बात करते बैठूंगा और लेक्चर जैसा हो जाएगा. आई एम नॉट अ लेक्चर ओवर हियर. ओके सो आपके केस में अगर सीएम चल रहा सेंटीसीमल स्केल पे आप दे रहे हो और अगर आपको एलएम की तरफ शिफ्ट होना है तो यू कैन स्टार्ट दैट केस विद 0/1. नेक्स्ट सिनारियो विल बी कि आप एलएम से स्टार्ट किए हो एंड यू वांट कि मुझे अभी सेंटीसीमल स्केल में जाना है. So ALM is the highly dynamized medicine. ALM scale is highly dynamized medicine. ये फर्क है LM और CM में. And CM compared